Focused laminar flow for ophthalmology. The rapid succession of numerous patients in ophthalmology rooms creates a favorable environment for the transmission of infection agents, essentially through the use of medical instruments. A conventional ventilation system is not capable of sterilizing the operating theatre in the short time between one operation and the next, thus promoting infections that can be transmitted from one patient to the next. Air, filtered through conventional ventilation systems, is first directed towards the floor and then distributed homogeneously throughout the operating theatre. Despite all measures to maintain asepsis, the floor of the operating theatre is always contaminated. Thus, bacteria can be transmitted to the patient through the instruments and surgical wound. Even in more modern operating theatres with a large ceiling-mounted laminar flow system, the instruments are almost always prepared outside the sterile zone and have thus lost their sterility before they are used. Operio is a focused laminar flow unit positioned in the perioperative area directly on the surgical wound, without introducing obstacles into the zone. The technology continuously produces sterile air, removing airborne particles and microorganisms from the critical zone of the surgical site and instruments. The Operio-focused laminar flow unit sucks in the air around the operating theatre and filters it through HEPA filters, cleaning the air of 99.99% of bacteria and microorganisms. The focused laminar flow acts directly on the surgical site and instrument table without being impeded, thus reducing by up to 95% the bacterial load on the surgical site and instrument table. The bar-coded sterile cover ensures maximum sterile conditions and also enables traceability of the system for defensive medicine purposes. Operio-focused laminar flow is the ideal solution for ophthalmology and intravitreal injections.